Welcome to Engage. I'm your host, Todd Hansen. Thank you for joining me as we tell the story of engaged learning at Utah Valley University. On this program, we showcase examples of students who are learning by doing. Today, we're spending some time with UVU's dental hygiene program, where the graduation success rate is 100%. Coming up on Engage. The dental hygiene program at UVU educates its students through hands-on learning such as clinics, anatomical structure construction, x-ray study, speaking to and educating K through 12 students, and creating a portfolio, all through engaged learning. Dental hygiene students at UVU are taught by applying their skills in the real world. They not only have excellent clinical skills and a wealth of knowledge, they have also been involved and engaged with their education and with their community and patients. The Dental Hygiene Clinic not only serves as a real-life classroom for students, but it also serves the local community. The dental hygiene practice is centered around engaged learning. For example, in the internship course, the student is able to select a topic or project that will benefit and help their particular office and their patients, as well as community groups. Some examples of their work include brochures on fluoride, gum disease, creating and improving their office protocols, and tobacco cessation programs. One student's project was critical in helping a nonprofit clinic to be financially functional and continue their good work. Because of these experiences, students are much more prepared after graduation than most traditional students will be. UVU's students are able to find and work at a dental practice as soon as they graduate. I'm here with Dr. George Veit and his wife, Associate Professor Christina Veit. Welcome, you guys. Thanks for joining us.
Thank you. Nice to be here.
Tell me first what you both do with this program at UVU.
Well, I'm the chairperson of the Dental Hygiene Department, and I also have some teaching duties, so I do that as well, and I serve as the advisor here too. And I've been here since 1999.
Wow. And what do? You work specifically with the clinic?
Yes, as a matter of fact, I was one of the people who started the program, and I came here in 1998, and we are up to our 12th or 13th class right now. I teach a lot of the hygiene, dental hygiene 1 and hygiene 2, which is the basis of their skills, and then I'm in charge of the clinic.
So how has the program evolved over the years?
Well, there have been some changes. An obvious change is we've been able to increase our student number. We started off with 12 students per class, and we've been able to raise that to 16. One of the major changes we've made lately is we just completed a complete clinic renovation about 2 years ago. And we had a wonderful clinic before, but now it's truly state-of-the-art, and it's just a wonderful place for learning, for treating our patients, and the faculty even love it too. They're happy there. I guess another major change has been we still have our AAS program in hygiene, which is the bottom line, meat and potatoes degree, so to speak, for practicing hygiene. And several years ago, we began a BS completion in hygiene that's offered online as well, and it's a non-clinical type of degree, and that seems to be working out nicely.
How important is it for students to have this practical hands-on experience in the clinic?
It's really the only way that they can see what they've learned in class, and then you can actually see the progression of their improvement. And the part I really enjoy is when I see the day that they've got it all under control, and they are really, you can see from their body language and from their confidence levels that they're ready. They've really picked up everything, and they are learning more and more every year.
It's really a great example in my eyes of service learning, in that the students have their didactic courses, and lab courses, and then when they go into clinic, they're applying and refining what they've learned up to that point while treating their patients. So it really, and serving the public at the same time. So it's one of those win-win situations. And we do have a strong and strict accreditation guidelines that hygiene programs and other healthcare programs have to stick to. And so we follow those and give the students the experience they need to be confident, pass their boards, and be the professionals that they turn into.
And the service aspect of this is what I just absolutely love, because they're providing such a valuable service to people who might not otherwise get it.
Exactly. Our clinic is open to the general public and community, and unfortunately, and I guess especially in these bad economic times, there's a lot of folks that are just left out of the traditional healthcare system. And we're finding more and more how important the health of your teeth and gums are, not just for your mouth, but the rest of the body. And our fee is very low, quite frankly. It's $25, but if somebody has financial hardships, we just make it 10. And that way, we're really able to serve our patients in the community. Again, a win-win, and the students get that great experience learning as they're helping the patients. And I want to mention, many of our patients are Hispanic, and I think one of the nice things about our whole setup is Christina is a native speaker, and she interacts a lot with our Hispanic patients, and you can just see their eyes light up, and they feel more comfortable being there, speaking with her, and her helping them out too. We
also not treat the patients in the clinic, but our students go to a lot of the schools. We go to areas like House of Hope, the WIC for young mothers. They teach nutrition for young children. The students might actually be more the ones that do participate. We at least visit 6 or 7 agencies through the year. And what I thought was that they need to learn a little bit of Spanish. So what I did this year is I was very lucky to get a grant from You Can Serve, that is a program by from American Corps. And I was able to provide materials in Spanish, like El Instructor Práctico, where the students are actually learning to explain the disease process in Spanish. We have a lot of flip charts where they can show how to floss, and we're finding that the patients really appreciate when their students are attempting to speak their language. It's really very important, and also it is very important for them to learn some Spanish, the dental terminology, when they go out to practice in the field, because you'll find that this area has a lot of Hispanics.
We send them out, or groups of them, routinely out to the Food and Care Coalition, which deals with poor people that are basically homeless, and they're able to help them out. The House of Hope, I think Chris mentioned, Community Health Connect. And so we have these wonderful community partnerships, which again just benefits everybody all around.
Yeah, it just sounds like a wonderful program. We're excited to hear more details about it. When we come back, we will have a few of the dental students join us as well. We'll be right back.
Welcome to Utah Valley University, home to an educational philosophy that engages its students in hands-on, practical education. I invite you to learn more about one of Utah's largest, fastest growing, and most dynamic universities.
Hi, my name is Tony. I'm a student with UVU Automotive, and this is my classroom. At UVU, you can graduate with a diploma and a resume.
Welcome back to Engage. We're here with some of the dental hygiene students, as well as Dr. George Veit and his wife Christina. Thanks for being with us. I'm curious from a student perspective what this program is like, just on a day-to-day basis for you.
You know, I mean, it's really just, when it comes down to it, it's like any other specialty program, except this program is really hands-on, and we have a lot of opportunities for service. We do have our lecture classes where we learn a lot of the theory and a lot of the, you know, the specific diseases, you know, pathology, the mechanics behind it. And then we're able to also go into lab and practice those. And then, like Dr. Veit and Ms. Veit said, we're able to go into clinic and be able to really put those things to practice, which for me is really the highlight of the program, that I'm able to go and actually help people with the things that I'm learning what to do.
What about for you, Bobby? What are the highlights for you?
Oh, there are so many so far. I think it's a really challenging program. I think it would be a lie to say that it's not. But at the same time, I think that all of the instructors are so sincerely interested in, you know, us doing the best. They want us to succeed. So just the people that we're involved with are so amazing. The other thing that has been something that I didn't expect when I signed up for the program was that with all of the service learning that we're doing and going out into the public, I've learned a lot about what the field has to give to the community, and a lot of what we'll be able to do, and seen a lot of perspectives from people who are in situations that are different than ours, and it's a really good feeling to be able to know that we've made a difference in their lives through these, you know, throughout the program, even if it's in just a small way.
Yeah.
So.
Yeah, and we talked a little bit about this earlier. People who normally may not get this service get it at the clinic. How satisfying is that for you, Lauren?
It's very, when I see people, especially people with families too, because it's expensive to take an entire family to the dentist's office. So we get a lot of families with kids too, and when they come in and I'm able to work with the kids or work with the parents and really not only clean their teeth for them, but just to show them how they can maintain it on their own is very, very satisfying. And that's one of the reasons I love clinic as well.
We talked about this at the very beginning of the show, and I threw out a statistic, 100% graduation rate?
Yes, yes.
That's incredible.
It is, and the success rate for our students is just really phenomenal. As you mentioned, 100% graduation rate every year since we've been functioning. And these ladies are representatives of how talented our students are. We're really very lucky with our students. They take 3 board tests in order to practice. We have a 100% pass rate on those. And one of the tests is actually, it's a national board exam. It's a one-day written test. They used to have a rating system for each school after the test. And when they were using that system, out of over 275 programs, our students placed number 3 in the country, number 4, number 5 twice. So they're just gifted and talented, and it just is a pleasure working with them and seeing how great they do and how they enjoy it, and they come out a real true hygiene professional.
What made you two want to go into this field?
For me, it's just, I always knew I've loved science and I loved math for a really long time, and I knew I wanted to do something in the health profession. I'm not a big fan of blood, large quantities, which is why I didn't want to do nursing per se, but I've always just been really interested in all things dental. You know, I never really minded going to the dentist when I was young. I really liked, and the hygienist just plays a really important part in that, and I wanted to be a part of that, so that's why I wanted to do that.
Well, I also kind of always have had an interest in, you know, all things dental. At one point I considered going into orthodontics, but I got married and I had a couple of kids, and so going to dental school wasn't that realistic for me anymore. But I tried to go into nursing. I got accepted to a program, and as I was working as an assistant at a hospital, I realized these are the worst hours on the planet. I never see my kids. And so I thought, well, you know, my first love has always been kind of with oral health and that kind of thing. So I looked into it and found out that this is a really, really great job for someone who has a family, because the hours are good and you get your holidays and weekends off, and you're never going to have a dental hygiene emergency probably that you'll get called into. So, yeah.
If I may say, to echo what Bobby just said. One of the wonderful things about a career in hygiene is the flexibility. Like Bobby was saying, you know, you can choose to work 1 day, 2 days, or more days, depending on your circumstances and your needs, etc. So it really does offer that nice flexibility with a nice salary and a wonderful profession as well.
Can you get this type of practical experience and classroom instruction anywhere else around here?
Well, there are other hygiene schools in the state, and you know, many throughout the country. It might be up to about 300 now.
Wow.
But I will say this: I just think we're the best around from a lot of factors, some of which we've talked about. By the way, the average ACT for these young ladies and their peers is above 25. They're just, I don't know if I can get into my own program if I apply. But they do, you know, any of the state schools do really have good programs, and we all are accredited by the same accrediting body, the American Dental Association. And so, you know, and so much is what you put into it too. And again, that's another thing I really enjoy about teaching is the commitment that the students have to being the best they can.
Well, I think though it's easy to be committed in this program because we do have so much support. I can't believe all of the instructors, everyone that we've had, they go out of their way. I mean, if we need extra help, they'll come in on weekends. They really do. They're there to make sure that we succeed.
And I never ever feel awkward asking someone a question. Sometimes I've been in classes where I'm intimidated by the professor and I don't really want to go ask anything, but I love all of the staff in our program, and I never feel, if I don't get something or if I need them to show me something, I never feel dumb or like I'm not authorized to ask this question, because I know that they're just going to smile and help me because they want me to do my best and they want me to learn the right way.
And there are times, I must say, I learned from you guys too over the years, from my students, and they've helped me when I prepare a lesson. I'll remember some of the things that we've dealt with, and it'll help me improve what I do.
And there are a lot of options out there. You could have chosen to go to a lot of different schools. Why UVU?
For me, just kind of like Dr. Veit was saying, it is hard to get in this program, but I think that really testifies to how great the program is. It's also, compared to other hygiene schools, it's a relatively inexpensive school as well. UVU provides quality education for a lower cost. I found there's a dental hygiene school down the road, as we refer to it, and it's a great program, but it costs a lot of money and they accept a lot of people. But it's just not the same one-on-one time we get with the instructors. So I'm just convinced this is the best place that we can get our instruction from.
Gee, keep talking. I like this.
We need to sign her up to do PR for that.
That's it. Yeah, I would like to add something to that. One of the nice things about the program too is the faculty-to-student ratio, and the fact it is a small program. In class, there'll be the instructor and 16 students. In clinic, there'll be 16 students, and to help them, there'll be 4 hygiene instructors and 1 dentist. So they really get the training that will help them the most with a faculty ratio like that.
Great. Good dental health is important to overall health. We're going to talk a little bit more about that, and we're going to learn the proper way to brush your teeth. We'll be back.
I'm Patty Garcia, a geology student at UVU, and this is Engaged Learning. At UVU, I'm learning by doing.
I'm Joe Luce, an anthropology student at UVU, and this is my classroom. At UVU, I'm sharpening my mind and my skills.
Welcome back to Engage. Before the break, we were talking about the importance of good dental health and how it relates to overall health. So can you speak to that, how important that is?
Yeah, in the last couple of years, a lot of research has shown just the correlation between your oral health, to your overall health. A lot of links are seen between cardiovascular disease and your gum health, and your periodontal disease can help for women. If you have periodontal disease, that can contribute to low birth weight with your children. Certain diseases can cause inflammation in your gums, and so it's just really important that you're keeping your mouth clean, in effect, to keep your whole body clean too. So,
in a case where like diabetes, not only is a diabetic more susceptible to periodontal disease, but also if someone has periodontal disease, it's harder to keep their blood glucose under control. So it kind of goes back and forth. So,
is that something, Bobby, that maybe you've noticed as you've treated patients in this engaged learning in the clinic? Have you noticed it sort of correlates?
Yeah, it's actually really interesting to learn in class these kind of facts and statistics, and then you get a patient in class and you'll see this like just classic sign of something, and then to go through and you bring your instructor, and turns out they really do have this condition that you've learned about, and it's like, wow, this is true. Yeah.
Go ahead.
I was going to say, sometimes our hygiene students discover something that's going on with the patient, like diabetes, what have you, and will make referrals to their physician, and it's a wonderful service provided.
Actually, they have to take blood pressure for every time the patient comes in the clinic, and we have sent some patients to their medical doctors to be checked, and I think that's a tremendous service, because so much of the high blood pressure are indications of other problems they may be having.
Okay, now let's talk about what sort of services you guys perform at that clinic.
Right. Well, we basically are just a full-functioning dental hygiene clinic. A patient comes in, we take their blood pressure. A lot of diseases we are able to detect things because, in theory, maybe people visit their dentist more than they visit the doctor. So if we see that their blood pressure is high, we can refer them to their physician. And sometimes people have found other health problems because we've found that their blood pressure is high. We do oral cancer screenings. We're able to examine the mouth to see if there's any risk there. Just the normal cleaning, polishing. We also do x-rays and panoramic x-rays, which we give them a copy of their x-rays, so if they do need restorative work, they're able to take that to their dentist, and they don't have to additionally pay for those x-rays to be taken.
I think too, one thing that a lot of, at least the patients that I've had, are surprised about is the thorough head and neck exam that we give. Before we even start, we check for lymph nodes, we check for signs of any kind of skin cancer, we do a thorough intraoral exam to check for any signs of cancer there, or just anything that could be pathologic that and I've had several of them say, like, I've never had this massage pat down before when I went to the dentist, but then when you explain what it is, they almost always are so pleased, like, what a great service.
Yeah.
So.
Two other of many other things that they do well too, and are very important. They'll do nutritional counseling for the patient, and one of the things we like to stress in the program is prevention and education. So they really are oral health educators, and they do quite a good job on that, explaining to the patient and working with them as to what's going on in their mouth, how to take care of it, implications of it. And so that's one of the main focuses, and they do very well with that.
And people think they know how to brush their teeth.
Right, and that's the nice thing about doing it in a clinical setting, is because you may get this generalized, this is what you should do, but when you come and you meet one-on-one with someone, then we can see what you're doing well, what you're not doing well, maybe specific things that you need that maybe the general population doesn't. So we can very much individualize the education that we give them to benefit them specifically.
So let's talk about how we do it right, because a lot of people probably think they brush their teeth correctly, but maybe have never been taught. And that's what you do in the clinic.
Right, exactly. Well, the first thing that I would say, the biggest thing that we usually noticed in our patients is that they're missing the gum line right along where the gum meets the tooth. And that's probably because they're brushing kind of straight on a 90-degree angle, and they're just kind of doing this sort of thing. But plaque builds up right along this gum line, and there's a little pocket in there where it can get underneath and start to do damage. So to make sure that you're reaching that, you want to move your brush at kind of a 45-degree angle toward the gum line and do soft circular motions. You don't want to go too hard because the gums are very fragile and they can be eventually brushed away basically. So you would start out with the 45, do your soft circles, and then when you're done with that motion, you're going to sweep it away from the gums to move it out and kind of move just all the way through. So circle, circle, sweep, circle, circle, sweep. And then when you get to the insides of the teeth where kind of your tongue touches, particularly on these lower teeth here, if you can see, when you have your brush like this, you're missing just a lot of area of teeth and of gums. So it's better if you can move it at a vertical position where it fits and do your circular motions here and sweep it. And then on the bottom, you would do the 45-degree angle as well, but you'll have it down, obviously, towards the gum line instead of up, and then sweep up. And you'll kind of do that all the way around.
And spend more than 30 seconds like a lot of people do. Huh?
Right, right. Generally, it's basically about 30 seconds on the outside of these teeth, 30 seconds on the inside, 30, and 30. So it'll be about 2 minutes by the time you're done. Another good tip, a lot of people miss the very backs of these back teeth. They're hard to hit. So one thing you can do is when you're trying to get, for example, if you're trying to get this lower back one or this lower top one, instead of opening really wide because that stretches your cheek out and makes it very tight, you close kind of halfway down and shift your jaw toward that side. It'll make your cheek stretch out so you can move your brush more like this and get behind those back teeth.
And floss every day, obviously.
Right, and flossing is really important too. Do you want to talk about that?
Yeah, just really quickly, we haven't got a lot of time.
Just real quick, yeah, flossing, obviously a toothbrush isn't going to be able to get everywhere that plaque is growing. I mean, you have these really tight spaces between your teeth and that's not going to work, which is why flossing is so, so important. You'll see a lot of cavities in those back teeth. They're not just on the biting surface, but they've encroached between those teeth too. So it's so, so important to floss every day because that eliminates the bacteria and eliminates your cavities. So.
George and Christina, you have done really well.
Well, thank you.
They know their stuff.
They make it easy.
Yeah, well,
they do.
And it's that intellect that you talked about, those high ACT scores.
Oh, gosh, and yes, they're just wonderful students.
All right, it seems like a great program. Thank you all so much for the education and telling us all about the engaged learning.
Our pleasure.
And we do have a little gift for you. We hope you have remembered what we've taught you today. And we have just a toothbrush, some toothpaste, and some floss for you that we
You've
would
been
love
looking at my
for
teeth,
you
haven't you? Yeah, all right, thank you. I will accept that gift graciously.
Terrific.
Thank you for joining us here on Engage. Next time, join us when we highlight more engaged learning opportunities here at Utah Valley University.